Dr. Carlos Saiz is known as the dentist to the stars. Footballers, actors, and singers all come to his office looking for the latest in dental aesthetic treatments. Until now, he only practiced in Barcelona, but he has just opened a clinic in Madrid, right on Gran Via, where we are with him to talk about dental aesthetics. Good morning, Carlos.
Good morning, Esperanza. It's a pleasure to have you here in the new Gran Via clinic.
Until now, you were only in Barcelona. What has it been like moving to Madrid?
Well, look, Esperanza, honestly, yes, until now I was only in Barcelona, but it's actually been many years since we started. Actually, this journey started 20 years ago, and, well, honestly, we were really looking forward to landing in Madrid since we were receiving patients from all over the country and from many parts of the world at our Barcelona clinic, which is located on Paseo de Gracia. And the truth is that Madrid is the nerve center. It's very easy to get here from any corner of Spain.
That's what I was going to ask you also, because you're very well known. You're actually an influencer yourself with more than 100,000 followers. So how did you get here? What has your journey been like?
Well, with a lot of time. Actually, it's not something that was done in just a couple of days. As I was saying, we first opened in the year 2000, so it's been a little while now. We have practically about 17,000 patients at the clinic, so that's, well, a lot of work behind it. Actually, well, now we're in an era of communication through social media, and, well, all of this makes it easier to reach more patients or more potential patients, but, well, it hasn't always been like this.
One of your specialties is microveneers. What makes them different?
Well, let me explain a little, Esperanza. Actually, in my clinics, the specialty is dental aesthetics. Practically 95% of the patients come because they want to have a more beautiful smile. So some, well, choose microveneers, others choose other types of treatments, but always with an aesthetic goal in mind. So broadly speaking, we could say that with the ceramic microveneers we use, patients can have the smile they want without needing to file down the enamel, which for me is the key, and always fully respecting, well, the preferences of the person who walks through the door. That is, we don't impose anything. Rather, we listen and try to capture a bit of, well, what that person wants, what they want to express with their smile.
You mentioned that with microveneers, there's no need to polish your tooth, and that's pretty important too.
Exactly. In fact, when I first started back when, well, all this aesthetic dentistry stuff wasn't so advanced, the idea of filing down a tooth just to make it look nicer was always something that, well, held me back a bit. I was never really convinced by it. And I thought, well, we either have to invent something or discover some other technique that allows us to, well, preserve the enamel, right? So, well, that's how it was back then. For about 14 or 15 years now, every aesthetic case I do without filing down the teeth, and it's something that patients really appreciate a lot, the fact that their dental health is preserved.
It's a very thin layer, right? Ceramic, you said, porcelain.
Yes, just so you get an idea, look, you have to imagine that a ceramic microveneer is like a little sheet of super resistant ceramic that's fixed onto the tooth.
How long do they last, more or less? What's their lifespan?
Look, this is a typical question. Almost all our patients ask us this. If the patient doesn't subject the microveneers to a major toxic habit, like, for example, nicotine, someone who smokes a lot, for instance, and keeps up with their 6-month checkups, which is also very important. That is, this is a treatment that, well, is placed, but then obviously it requires maintenance and supervision. 10, 15 years in principle without any kind of problem. I have patients who have had veneers for more than 15 years and they still look fantastic.
And without any pain, right? Is it a painless treatment?
It's a 100% painless treatment, which makes it super comfortable. We usually schedule it over about 3 visits. Sometimes we can do it in 2 if the patient has to travel, I don't know, from another city in Spain that's not Madrid or Barcelona. And as I mentioned before, we completely respect the personal taste of each person.
So we could say that dental aesthetics is like getting a custom-made suit.
For us, yes. Look, as part of our signature approach, when someone comes in to get a smile design with veneers, we really take their personal preferences into account. In fact, we have them fill out a sort of short survey or questionnaire where we ask them what kind of shade of white they like, if they like the size, if they want to change anything specific, or if they have any particular preferences. So from there, we start the design process. I give advice, but I don't impose my own aesthetic judgment because in the end, You realize everyone is different and each person is their own world.
So you can customize the color, the shape, pretty much everything that can be changed with a veneer.
Exactly. Something I'd really like to emphasize is that the patient will see the result at all times before undergoing the treatment. We do the entire study on the computer. From this, we make a 3D print that we will try on the patient before placing the veneers. And so the patient will have the chance to look in the mirror and see the new design in their mouth, which is fantastic, because if the patient wants to make any changes, since the treatment hasn't been done yet, there's absolutely no problem. It can be adjusted.
It takes 2 or 3 sessions to place them. But how much time usually passes from when a patient walks into your clinic until they leave with their new smile?
Of course, typically, in a standard case, it usually takes about 2 or 3 weeks. It's absolutely true that, well, I have a dedicated and skilled team behind me who meticulously craft these specific types of veneers. And in some particular cases, if everything is exceptionally well coordinated and planned, we can also offer a much more express and expedited service, you could say, for someone who is perhaps getting married very soon or who genuinely needs to have it done much more quickly and efficiently.
I think there's a famous actress and some singers too who have them. Who are they?
Well, actually, let's see, we can't really reveal much about what treatments each patient gets, but well, a lot of well-known faces come through here and also many anonymous patients, which we also love to have. We could, well, give you a name or two. For example, right now the actress Daniela Santiago is very popular. She starred in the series La Veneno, which was very successful, by the way. Well, she shows off one of our smiles, and so do the Gemeliers brothers.
And the latest to join the clinic was Pilar Rubio, right?
Almost the latest.
Almost the latest? Well, give me a surprise. Who was the last one we had?
Well, the last well-known patient I saw was actually just yesterday. Sandra Barnita was here. And yes, Pilar Rubio was with us last week. In general, it's like I was telling you before. Well, they're looking to, be even better, even though sometimes they already look amazing. Sometimes they have healthy, beautiful smiles, but still they want even more. You don't have to be in bad shape to want to feel good.
Let's talk about other significant smile enhancement treatments, in addition to professional whitening and clear aligners, which are commonly used.
Yes, well, basically, like I was saying, almost all of our patients typically come to our clinics for aesthetic reasons. So to put it simply, we can effectively group them like this. Those who want a bigger, more significant change would go for a comprehensive smile design with no prep veneers. Others, clear aligners. We do all of our orthodontic treatments with clear aligners. Honestly, we don't use braces because all our patients are adults with a more or less active social life, and, well, they always want to have a nice smile. And we also do a lot of whitening treatments, to be honest.
Also, I think aligners have really shortened the treatment time now, right? Yeah.
Yes.
They're no longer those huge orthodontic treatments that last 1.5 years, 2 years.
Yes, honestly, when I approach clear aligner treatments, I always try to be very practical and as quick as possible. Sometimes we can divide patients into 3 main groups. Some finish in 7 weeks, others in 16 weeks, which is about 4 months. For more complex cases, in less than a year, practically all of them are resolved.
And the whitening system that you use most often, is it one session in the clinic and then the patient continues at home? Or how does it work?
Well, up until now, basically what we do in almost every case is in-clinic whitening. We use an American system and the patient comes to the clinic, we settle them into a treatment room, and they can have their phone in their hand if they want to be distracted, or they can just relax. And normally, we don't usually combine it with at-home treatment, since the in-clinic procedure works really, really well. Now we're testing new whitening products from the UK, which also seem like they're going to be pretty revolutionary, but we're still in the trial phase.
Hey, earlier we talked about aligners, and about 2 or 3 years ago, there was a big controversy about whether Queen Letizia was wearing them or not. As the professional, do you think she actually wore them?
Look, I can't help it. It's just a professional habit. I always find myself looking at the smiles of public figures. I think she did wear them, at least in the photos that were published, it looked like she was wearing them. Unless there was some retouching done to the photos. It's true that I would make a small adjustment, if I may say so.
What would you do? Go on, tell us.
Well, with all due respect, she has a smile. She has a slightly concave profile. She would be a great candidate for microveneers on the upper teeth. Also, she has rather prominent canines, which makes her features look a bit more pronounced, and, Well, I know she takes really good care of herself, and
Would you maybe trim the canines too?
yes, perhaps I would gently soften the prominent canines, or maybe we consider doing veneers that are a bit more. That would significantly improve her overall facial profile and aesthetic balance.
That's another thing. With veneers, you can add volume to the lips, so
A little bit, of course, but the dental support really affects the lip support. So yes, of course, in the end, with a smile, we can also improve the face, not just the teeth.
well, thank you so much, Carlos, and I'm going to stick around and take a look at this wonderful clinic.
That's great.
It looks more like a Hollywood set than a dentist's office.
Well, perfect. Make yourself at home.
Thank you so much.
Thank you. It's a pleasure.